And we've all been trained to be skeptical, and I'm telling you, everybody was skeptical. But once you see it, the attitude's completely turned around.
This is not a radical new approach. This is not something that no one would ever consider because it's some radical way of entering the spine. They realize people use the epidural space for pregnancy, for pain management type of injections. They know that a disc problem, when they think about it, actually lives in the epidural space. They've just never thought about it in that concept. If they remembered back to early medical school anatomy, the canal was actually cylindrical, and the canal was a potential space all the way around the spinal cord. And thinking about it in that way was completely different than anything we were ever taught from surgical training, anesthesia training, or pain management training. The traditional paradigm is unsatisfactory at best, dangerous at worst. They also know intuitively that they don't want their patients to have spine surgery. They see the results. They see patients continuing to suffer, so they need to open their mind to a better way.
What we're seeing with a lot of these procedures is people had this chronic intractable back pain. We do the procedure. The MRIs and scans they've had up to that point have been fairly unrevealing, haven't showed a lot of glaring problems. That's why they weren't referred on to the surgeons, or the surgeon said, look, there's no surgery that'll help you. But you do the acroscope procedure and you'll find little bands of adhesion, something that is irritating the spine and causing their back pain. And so almost anybody with back pain is a candidate.
In our procedure, we use the catheter. It has 2 ports in it, one for the laser, one for the scope. So that is what is introduced into the back through this small incision and into the natural opening, which goes into the spinal canal. Other less invasive spinal procedures require a patient to have a rod put into the side of their back, which it's a smaller incision than a traditional back surgery, but you're still going in through healthy skin, muscle, and they do need to remove bone at times in order to gain good access. So it is much more traumatic for a patient.
We tried to do this type of procedure as far back as 1999. It was just the laser technology wasn't to a point where the safety was there. There's a lot of people that understood that this was the best method to get into the spinal canal, that gave you the best potential to treat multiple problems at once. And just like every other specialty, the technology advances. Well, now that the laser technology has been refined such that there's not a lot of collateral damage, the laser is much more controllable. So we can be very precise about what tissue is affected by that laser when it's activated. That's what really made the difference.
I learned a procedure whereby from the patient's side, from the side of their back, I inserted an instrument into the normal disc tissue using X-ray guidance, and then used a laser to remove normal disc tissue. At the same time, the procedure of epiduroscopy developed. What I did was combine those two procedures by realizing that the disc problem actually occurs in the bottom part of the canal, or what we call the anterior epidural space. So if I could insert that scope into the anterior epidural space, which is just the other part of that same cylinder, I could then find and treat a disc problem in that space and just treat the herniated or pathological or part of the disc that wasn't where it was supposed to be, and leave all normal tissue alone.
Here at North American, we offer something that nobody else has to offer, and that is a very minimally invasive surgical procedure that perhaps you have not been able to get your patient to the point to where you'd like for them to be. And we can go in with a 1/4 of an inch incision and actually go in and diagnose whatever the problem might be and treat it and fix it all at the same time, which is huge in today's medical advancements, to actually go in and see things live, 3D in color, and be able to take care of it and fix it all at the same time and make them almost completely pain-free is incredible.
Just like a traditional approach or a surgeon, we have the MRI scans on all of the patients, and we pay particular attention to what the MRI scan shows. But from the start, what's clearly evident is the amount of pathology, the amount of problems you can see in the back that the MRI scan gives no hint of.
We always use that natural opening at the sacral hiatus to be able to inject different steroids and medications. But now with the flexible catheter and endoscope, we're able to do the AcryScope procedure where you can use that opening to access the epidural space, follow it up to the level of the disc problems, be able to look at the disc, look at the nerves, figure out what the pathology is, and then treat it. And you can go to multiple levels. You can go to both sides, whereas traditional surgery, they pretty much are limited to 1 or 2 levels on one side. It's hard. It's be a major surgery to try to look at multiple levels on both sides.
We have a much better success rate for getting patients good outcomes, feeling better, less pain, numbness, returning back to normal sensation. We can take care of scar tissue. That is something that traditional surgery definitely cannot help with, and in fact causes a large amount of scar tissue. And we do see patients who have had the traditional procedure in the past come into us because they're having problems with the scar tissue formation around the nerve roots that is caused from their previous surgery. So that's a great thing about this laser procedure. The laser does not produce hardly any, if any, scar tissue, and we are able to see it and treat it. So that's a very effective thing for our surgery.
I had all the surgeries before, all the metal in my back and everything. I went up there. They had me out in a couple hours. I got to go home, sleep in my own bed. It took 1 stitch to stitch my back up. You don't even see that anymore. And I was up walking around the next day, and 3 weeks later, I was in the gym lifting light, and then 2 months later, I'm back racing bikes again.
Here at North American Spine, once the patient has undergone his surgery, they are pretty much released back to their primary care or referring physicians for continuing care, such as physical therapy or any other regimens that they've already had previously set up.
What I always tell the patients is, look, if we send you out of here pain-free today, it's the same spine you're going to have from now on, and it's kind of up to you and your physician to work on how to take care of the spine for the long term. And so it's just get you over this episode, try to fix this problem, and then hopefully, no offense, hopefully never see you again. That's the idea is try to keep the patients out of the doctor's office.
We're going to see the majority of traditional back surgeries go away and be replaced by the AcryScope procedure. And the reason is self-evident. If somebody has a choice, if somebody has a traditional slip disc and a pinched nerve in their back, and you're given a choice of, well, we can do surgery on your back where you're under general anesthetic, you'll be out of commission for several weeks, we're going to do an open surgical procedure where we have to remove bone in your back and weaken your spine to take it out. What's the other choice? Well, we'll do a procedure that doesn't require an incision like that. It goes through a natural opening. It doesn't require general anesthetic, but it's going to accomplish the exact same and arguably better results because the AcryScope can do more than a traditional procedure by sealing over the rest of the disc. Well, to me, it's not a close call in defining this a revolutionary procedure.